Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who've heard my content in the past. If you want to know three things to consider before you give up on the profession of physical therapy, you need to tune into this episode. Before going to the podcast, what is new? What is bigger and better? I am coming off a huge high, and I'll explain in this podcast on why. A lot of good things happening. Coming off the last month, it's been rough. A lot of personal and life challenges, but life is good. Always trying to stay focused on the good, on the things that are ahead. My kids are doing amazing. I'm just so proud of them. The conversations that they're having. My son Zach is he's a very logical human being, and very rational. And for a 7-year old, it actually surprises me, and it gets me on some of the things that he says. And if you were on my last podcast, one of the words he's overusing, but using properly in context, is satisfying. I don't know where he gets these words, and it's amazing to see them put it all together. And my daughter and my son Jacob are doing awesome. Jacob's vocabulary has been off the charts, and he's a sweet, sweet little boy. And where does he get it from? Probably more of his mom than me. I'm more of the logical, very short parent, and my wife is very understanding, and just a pleasant human being to be around. So that's where he gets it from. Other than that, I am back in business with training and fitness. It's been steady. Back is a little tight. If you guys know, about a month ago, a month and a half ago, I injured my back, and it's talking to me again. So just playing with balancing fitness. All right, on to this podcast. Okay, so I'm coming with fire today. If you are a consistent listener, you're going to enjoy this one. If you are a new listener, this is going to hit you in the face, and you might not like me after it, but that's okay because you need to hear this. So, I just had my annual planning meeting with my entire team at Sports Performance Physical Therapy in San Diego, California. And I brought everyone together, and we really just focused in on what it is that we want to do as a company. What's our mission? What do we enjoy doing? What are we not good at? And it was amazing to hear everybody's feedback. And as I talk and I listened, it really fired me up on what do we do for the patients and athletes that we serve. And I'm going to share one of my biggest takeaways, and how it relates to what you do inside your clinical practice, the thoughts that are going in your head. I understand you. I get you. I know where you're at. I know your frustrations. I know what's happening to the profession. I know what you think about behind or after work. And it's not just you who thinks about these things. It's not. I know that you're frustrated with documentation. I know you're frustrated with productivity standards. I know that you are frustrated with how you want to be able to treat patients and athletes, but sometimes it gets frustrating when either insurance is the problem, or that patient can't come back, or whatever logistics, or it's your company, it's your team members, it's whatever it is. And after coming off of this meeting and coming with fire, I want to share it with you. I want you to reconsider before you give up on this profession. Let me share what's possible and what you can be doing, because once you get in that brain, I understand what happens. It's like it's a self-fulfilling prophecy. Like, I don't enjoy this anymore. Then something bad happens at work, and then you're like, yeah, it's reinforced. I don't love it. And for some of you who are just new to the profession, you might not have those feelings, and that's fantastic. I want to keep you away from that. But maybe some of those who maybe been practicing a couple of years, and I don't even want to call it burnout, because that's not just burnout. It's like, is this the profession for me? And I know a lot of people ask that question. I've been practicing 15 years now. going on 16 years now, and I have more fire than ever after 16 years. And has it dropped? Not much. And there's rough years when you're going through, different times in your life. You have a kid, or you buy a home, or you buy your first car, or you get your first apartment, first townhome, whatever it is that all your milestones in life. And you struggle professionally to keep up at the same pace. It's very tough. It's not enough. You don't have enough energy or time in the day. And so for those who have thought about quitting the profession, like, is this for me? Do I really enjoy this? I want you to consider three things, and I'm going to share those today. And I'm also in different forums, groups, email lists of physical therapists all around the country. And I have heard it in the time of this recording. It's 2024, January of 2024. And I have heard in the last 3 months more than ever, people asking, uh, what other, what if you guys weren't going to do physical therapy, what would you do? What else can a physical therapist do besides treat? Um, What are we going to do about these productivity standards? Anyone find a way to get reimbursed more? Anyone find a way to treat less people with less paperwork? Anyone find a way to get more productive with paperwork and not have to take it home or over the weekends? These are normal comments that people have. And the funny thing is, you probably think them. Some people just speak it out loud. And what those questions are headed towards is this profession for me? Is this sustainable? How can I do this? Do I even want to do this? Is it worth it? And so, before you give up and you have all those things in your head, I'm here to share that one, I think that's very normal. It could be your setting, it could be yourself, it can be your environment, your work friends, your colleagues, who you follow, what you're doing, the patients you serve. I mean, there's so many layers to this. So I want you to consider three things as you go along this journey. And I want to share it because it's everything that I would coach anybody and mentor anybody that's in my personal like wheelhouse, my small inner circle. And for those who are inside my academy, you'll get this this month too. But I think it's very important for you to consider these things as you navigate. What's your professional career and your path look like? So I have some things written down, and I'm going to share them with you. All right. So um, before you go into like maybe I just need more athletes on my schedule. Maybe I just want to see, I want to treat more back patients. I want to treat more ankles. I want to treat more. Before you go during that down that rabbit hole, let me share what you do at a very high level, so that way you don't get lost in the weeds. You have patients who are people, and these people have problems, just like you. They have normal problems. We all do. Whether that's it's January, so everyone's thinking about taxes and all these other things. And for some people, it's money. Some people, it's that they can't perform at the highest level, elite level athletes. Maybe it's a mom who is having back pain and doesn't have enough time for themselves to be able to have a better quality of life, and they're always paying attention to their kids or their family. Maybe it's a high school student who is about to get a college scholarship, and they can't do these things because they have knee pain and they're going to risk their scholarship. Or maybe it's a young professional who has neck pain, and they work at a computer all day, and this is the way they make money. This is their longevity. They're just starting their career. Each of these examples are people who have problems, and these problems are magnified inside their personal life. And maybe that young professional with neck pain can't even enjoy the gym because they're in so much pain, it knocks them out throughout the day, and they're not even motivated to go in the evening. Maybe it's that busy mom or parent who loves going to the gym, but because that back pain is interfering with them, they choose to, not have so much stimulus, and maybe they think that's the answer. Maybe I shouldn't go to the gym, and maybe I should back off a little bit. Maybe that's their community, that's their outlet, that's their personal space. and that's very important to them. Maybe the high schooler now has internal demons and thoughts of, what happens if I don't go to college or when I don't get that scholarship? Maybe my parents are going to not be happy with me, but they're going to be frustrated with me. These are the thoughts that go on to people's heads. And you might think, Chris, that's a little extreme. No, it's not. It's every person that you see. All the patients and athletes who come into your clinic, go onto your table, have their story. They have a story. Think about this. Why would they go see you and spend an hour to 2 hours of their life? You're a pretty amazing human being, but not that amazing. Let's be realistic about this. People don't go to see physical therapists because they're happy. They have a problem. Your job is to solve the problem. The question is, are you looking at the right problem? You have a solution, but are you looking at the right problem? So, for instance, high schooler with knee pain, college scholarship. Immediately, you do the subjective on the initial evaluation. What's your problem today, Samuel? You have knee pain? Let me take a look at it. Ooh, knee valgus, not good. Ooh, anterior shear forces, not good. No wonder why your patella is forced out, having issues. Oh, bad shoe wear. That's probably it. Um, many reasons why have people have knee pain. But you look at the impairment, you look at the movement. Then what's your solution? Let me stretch it. Let me mobilize it. Let me put some needles in it. Let me do some uh, repeated movements. Everyone has solutions, right? But the real problem could have been that this person didn't train for 4 months. They decided to join the team, or they were lazy over the summer and they thought they were that good and they didn't train and they only ramped up really quickly over a month. So the problem was not necessarily their movement, it was their lack of preparation. So the reality is that we're solving a problem, but the real problem needs to be okay, great. Um, Clearly, you have to practice and you have to train and you have to compete at a high level over multiple hours a week. I have to figure out how to back you off and lower the stimulus so that you can have less aggravation of that tissue, but still be able to train for the full season. Now, while I needle, stretch, strengthen, repeated movement, whatever it is, I also need to quality control everything else. And my point to that is this person's problem wasn't impairment based. This person's problem was a fitness volume intensity who happened to have impairments, who showed up with knee pain. So the problem you're solving is very impairment based and movement based. But the real problem is in their health, fitness, and overall lifestyle. Let's take the mom example or the parent who has back pain. And they use this time to be allocated towards everything else. If you stop them from exercising because of back pain, you're actually going to worsen it. Why? Because they're going to become more deconditioned. They're going to lose motivation, gain weight, not enjoy the gym, and lose their circle, lose their confidence, and now they're even more miserable than ever. But the physical therapist thinks, well, you know what? It's because of your transverse abdominis. Ooh, it's your erectors. Oh, it's because you flex all day. Now you need to extend. Oh, it's because your psoas is so tight and you got to pull them in. All of those, they've existed for months to years. Now, you changing them is going to be great. But what else was contributing to that? Were they holding their kid too much on one side? Was it the bad form in the gym? Was it because they went all out and it was January 1st and went 7 days a week? Your transverse abdominis and your rectors and your psoas aren't going to fix that. You still have to quality control. What I'm saying is, I just think you need to open your eyes to what you do for people before you start getting stuck in this impairment, movement, blah, blah, blah world where it never ends and the insurance is dictating what you need to be able to do. There are patients and athletes out there who have the same struggles, same problems in insurance. How about you solve the main problem, the real root, and look above and beyond movement, impairments, all these other things that we're trained to do and help them improve their overall health and fitness to accommodate the real root of the problem so you can have more bang for your buck and actually have more of an influence in their daily activities versus just coming to you twice a week. The root behind all of this, if you haven't heard, in 2024, there was a big announcement for a lot of insurances and government funding to Medicare, Medicaid, all these other federal funding sources. There's going to be about 3 to 7% cut to reimbursement. Now, whether you own a PT clinic or not, you work in a PT clinic or whatever it is that you do, what that does is it negatively impacts how that contributes to the company. Now, a business owner, and I'm an owner myself, I have to think, well, how does this impact my company? I have a couple options to make. And you need to know this because if you're owners and whoever is in leadership and management should be disclosing this to you because it impacts your job and your happiness. Well, when 3 to 7% cuts impact a PT clinic in reimbursement, what that means is there's a couple of options to make. You either cut physical therapists and you have less people actually treating, or you increase the standards to now increase the number of people you have to treat. So what that means is people will now, if you were treating one person, you might have to treat two people. If you were treating two people, you might have to be treating four people an hour. Now, what's that's going to do? It's going to impact quality of care. That's the first thing you have to understand that. If it impacts quality of care, you're not going to enjoy what you do. The patients you treat aren't going to be able to get the outcomes they wanted. But there's no way around this if reimbursement keeps dropping. You have to see more people. That's just the nature of it. So that's why there's a lot of people wondering, I don't know if I can handle this anymore. I don't know if I can treat 20 to 40 people a day. Is that sustainable? That's the conversations people are having. So before you start thinking, man, I don't know if I can do this and I don't know if physical therapy is for me. It's all about what's the label of physical therapy to you and the patients you serve. Physical therapy to an insurance company is a certain thing. Physical therapy to you is very different. Physical therapy to you is improving quality of life, having like direct patient care, one on one, having time. And while your time with them is going to drop, you have to figure out how do you maximize that time. And I tell you what, it's not going to be just in movement. It's not going to be just in manual therapy, whatever it is. You're going to have to figure out other ways to impact somebody's quality of life without getting your hands on them or getting your eyes on them. That is your superpowers. Your superpower is your eyes and your hands. What if you don't have access to that all the time? And I'm not talking about virtual physical therapy. I'm talking about helping people across a lifespan, across their fitness, understanding what they do on a weekly basis, understanding what they do on a quarterly basis, how you can impact the total amount of stress being applied to them. At the highest level, you have to understand you're helping people with their health, with their fitness, and their wellness. You have to understand that. You don't help people with movement. Stop saying that. You help people in their health. What that means is you got to start looking at really, it's not knee pain because of knee valgus. It's knee pain because of poor preparation. They didn't know what they were doing over the summer. You got to get them on a program, help them understand and decrease how much they work out or increase the total amount of stress, decrease the total amount of stress. Figure out what you need to do for them in their daily life, not in the clinic. What do they need from a recovery standpoint? Do they need to be sleeping more? What's their nutrition like? Those are going to be more bang for a buck as healthcare providers than a simple exercise for knee pain. Now, you can keep fighting this all day and you can stay in the movement and impairment based world. You can do that all day, but you're going to be stuck treating 4 people to 6 people to 8 people an hour. And now you might say, well, that's just the how my clinic works. And that's fine. That's how businesses have to work. But what you have to understand is just because they do that doesn't mean you're happy. It doesn't mean that you're going to enjoy what you do. And while you can stick it out, I'm telling you right now, you're going to consider, is this the profession for me? And before you do that and you give up, it's not just the business you work for. This is a problem nationwide. People will have less reimbursements, which means you have to see more people or be more creative in how you serve people. Those are the only way outs. The only way. Otherwise, you're going to be facing an uphill battle for the next few years and you're going to question it. I want you to come back to this podcast. My job is to give you a better perspective on what's currently happening and what you can do for yourself and anyone in your inner circle. If you keep hearing that, man, this profession sucks, these patients suck, I have to treat more people. Can you believe that? Documentation, productivity. Yeah, that's because that's the circle you're in. I'm telling you right now, you got to get out of that mindset. There are people who want more for this profession, like me, who are willing to be creative and work around that. What are your options? You're going to acquiesce to the problem and complain with everyone else, or you're going to make a difference? And all you can do is you start with yourself first. So you have to consider, what do you do for people? You don't do movement, you don't do impairment based treatment, you don't do manual therapy. You help people with their health, their fitness, and their wellness. Figure out how you can tap into those other three resources so you can have a greater impact on them. Look at those resources. Health, how do you improve their health? Fitness, how do you improve their fitness? Wellness, what else can they be doing from a recovery standpoint? You do attack those three, that's where your head needs to go. That's number one. Number two is, now you have to be able to convey that to the person that you help. They might be like, well, I came for you for a knee pain. Yeah, but you have to understand it's a total amount of stress. So now we have to develop a strength and conditioning program to help you understand how to apply stress across time so this doesn't happen again while I work on your movement and everything else. Now you added value to your service. Now you can do something different for them that no other physical therapist can do. Well, then maybe you need to how to figure out how to create a injury prevention program after that of pain. Why? Because you don't want to see them another 8 visits over, and you know you can't be able to see them. You can't see them more than 15 minutes. So you might have to build in that program, develop that for them, and now they have the outcome they want. They just need that program. They just need to be able to do that. Now they come to see you monthly. You're going to have to be more creative to get the outcomes that you want with the patients you want. The third one is, so number one, figure out what you do for people first at a very high level. Stop thinking movement, stop thinking impairment, stop thinking manual therapy, improve people's health. It's number one thing you can do. Secondary is, how do you work with them and being able to convey that information? Because just because you have the training doesn't mean that you can implement. So the second part of that is figure out how you can deliver that message. You just have to talk to patients, talk to them about what they're looking for. Ask the questions, ask the questions, ask the questions. If you're not asking about their overall health and what they do for a living and what they do for fitness, there's no way you can get onto that next level. So just because you're good at it doesn't mean you're going to be good at delivering it. That's where PTs struggle. How do I convey this? How do I say this, Chris? It's mind blowing to me that professionals, 10 years into practice, adults, 40, 50 plus years old, we have a trouble conveying that information. The reality is, it's a simple conversation. Ask, what do you do on a regular basis for exercise? What's your work life look like? Like, are you standing? Are you moving? Great. Oh, I see. You sit and then you deadlift. I see. Rather than giving you more flexion based stuff, how about we look at your mechanics? How about we look at your ergonomics? Now let's have you stand up for a little bit more. How's your sleep? Let's talk about that. Oh, you only sleep 4 hours and you have back pain and you train 5 days a week and you have poor posture and you have poor mechanics. Guess what? Your flexion extension exercise, your manual therapy is not going to help the total amount of stress being applied to that back. So you have to look at how do you improve their health profile. Next, convey that information by asking questions. Number one, figure out what you do for people first. Number two, figure out how to deliver it. Three, now that you've figured it out, oh, I'm the health expert. Number two, I now had that conversation. Now, number three is I have the pressure. Now I have to deliver on that information. Now I have to figure out what's the best practice or best guidelines for stretching, best practice practice guidelines for nutrition. What's the best practice guidelines for sleeping? What's the best practice guidelines for strength and conditioning? What's the best practice for injury prevention programs? Those are better problems to have than figuring out how do I do more manual therapy to get better outcomes in 15 minutes. You will head up a horrible, horrible wormhole trying to figure out how to get better at manual therapy for the next 5 years of clinical practice. Why? Because your impact will be very, very small relative to how many minutes and hours you spend with somebody across a day, a week, or a month. That time is going to be decreasing. Rather than get better at hammering nails, figure out how to create a better foundation of the house. You're so focused in on how to create a better outcome in a shorter period of time versus how do I create the best outcome in the shortest amount of time by understanding what they do across a week, across a month, with reimbursement dropping, number of visits going up, quality of life will go down unless you understand what you do for people and you get more creative on how to deliver that outcome. It is what the profession of physical therapy is doing right now, and you have to. So, physical therapy will go down that rabbit hole. You, as a professional, need to keep growing and ascending more than the profession. The profession is not your limitation. Your own brain is the limitation. So before you give up on this profession, how about you improve how you view what you do for people and let everyone else go down that rabbit hole of complaining and trying to figure out how to get better at manual therapy in 15 minutes. That's where everyone else is going. You go the other direction because that is where I'm taking anybody that I mentor, anybody that's in my wheelhouse, anybody in my inner circle, because that's what we're trying to figure out. Everyone is going to get creative. And that's what I share with my inner circle. So if you're stuck, if you are like, or you're going that direction, you don't want to be part of that, come over to the dark side. I have multiple programs, I have multiple mentorship opportunities. I just need to get you closer to me. I want you to figure out, stop listening to the junk. Stop figuring out how to get better at something that is a declining service. Figure out how to get better and more creative on how you can deliver a different service, a better outcome, and not be capped by somebody else saying that you have to do it a certain way. If that's of interest to you, there's two routes right now. If you are a younger clinician, new to my programs, I would start with my Kickstarter program. It's an 8-week online mentorship course. You can find more information, drchrisgarcia.com/Kickstarter. If you are sick and tired of things and you're like, I just want one-on-one time. I want to be able to navigate these. I want to have good conversations. It's all in my brain and I don't feel comfortable talking to other people about it. I think that this is only me. I am sick and tired of this. I'm questioning whether I'm burnt out or not. You need to join my academy because I know what you're thinking. I've coached people through it. I've mentored people through it. It's normal. You just got to get creative with your environment. And no, it's not like, well, I'm a new grad or I've been practicing 20 years. I'm different. No, it's not. We're all the same human. We all process the same information. The difference is we all have thoughts, right? We all have thoughts. But the difference between people who have negative thoughts or poor thoughts or great thoughts and the ones who are successful are the ones who execute on those thoughts. So while you can say, well, I'm going to change the world. And then 2 weeks later, you're like, still hate my life. I still hate my professional career. I hate my job. Those are all negative thoughts. The people who execute are the ones who are top of the mountain looking down. And it has nothing to do with how much prestige and notoriety they have. It has nothing to do with it. It's just a person who could create thoughts into execution, to action. And if you are stuck in your head and you're like, I need to work through this. Or I have the ideas. I just need to know where's the right direction for me. I'm ready to do it. I'm ready to create action. In either case, my Sports PT Academy is the place for you. You can go to drchrisgarcia.com/academy. And if you're still in the works and still in the middle, take any of my courses, listen to the podcast, follow along, send me an email. I'd love to have a one-on-one with you if you have any questions about anything that I do or can do inside your world to make you a better professional. Send me an email, drchris@drchrisgarcia.com. In either case, I'm here to help you absolutely crush it in your professional and personal career. So, thanks for tuning in. I hope you guys are doing absolutely amazing and living life to your fullest. I will see you guys on the next episode. Take care.